During that time, it was difficult for us because we got patients coming from other hospitals looking for very essential drugs. A paracetamol, they would not find it. A cotrimoxazole, they would not find it. Number 3. Very often we get very sick patients. Mothers will come with the children who have respiratory tract infections, they have gastroenteritis, they have pneumonia, they have malaria, they have also HIV and AIDS-related diseases. Adults come very often in scotch carts, in wheelbarrows. They are mostly bedridden.
They thought I was dying since my CD4 cell count was 4, and I was attacked by pneumonia and meningitis at the same time, and I had also oral thrush.
The country needs about 65 million worth of medicines each year, and it has not been possible. This is where our government have sat down with the partners, and the partners, I mean the donor partners.
At that time, many donors and many partners to the Ministry of Health were providing drugs for HIV and AIDS, but nobody was providing any essential drugs to the system.
In 2006, we anticipated that the situation was not likely to improve and that we needed to focus more on health, and particularly on 2 key aspects. Number 1, human resources, by maintaining a certain level of training and also making sure that nurses and doctors would not leave Zimbabwe. And number 2, by providing essential medicines to this country.
This is our bulk storage area, where the stuff that we saw on that receiving section comes through here to be stacked on these shelves. So basically most of the stuff we got for the VHSSP program is stored in here. We do get all the drugs that are necessary for every hospital, clinic, depending on what we consume here in Zimbabwe.
Last year, but one, people had lost confidence in visiting the clinics because when one visits a healthcare facility, the nurse will be there, maybe they will prescribe simple items like paracetamol or simple antibiotics. There will be nothing. So if a patient maybe visits the facility on 2 or 3 occasions without any medication, definitely they will lose confidence.
Since I was a very ill patient with that very low CD4, I suffered, I had a number of problems. I started benefiting from drugs like miconazole for my oral thrush. They helped me a lot.
Ndakabara Anthony paMurewa Hospital. Pandakabatsirwa Anthony akazomborwara achita mudumbu nekurutsa. Tikaenda naye kuMurewa Hospital. Tikanobatsirwa zvisingaiti nekuti akapiwa ma-injection nemamwe ma-tablets. Kubvira ipapo akazongoita 2 days ndobva aita zviri nani. Saka nanhasi hatina kana dambudziko.
Looking at the vacancy levels in the rural areas, and they noted that we didn't have doctors, we didn't have pharmacists and so on. So they came up with an incentive structure. They originally started supporting 24 districts, but that has now been the basis for the current incentive package.
We initiated at the end of 2007 what is called a retention scheme, and we decided that we needed those nurses and those doctors to remain in Zimbabwe, and for that we needed to assist them financially, and we did it. It was considered at the time against what normally a donor would do in Zimbabwe, but we felt the contrary. We felt that in order to be able to distribute medicines in this country, we needed nurses to distribute them.
Because we are parents, we have children who are going to school, so it's assisting us very much, especially on the fees. And basically on our basic things, we are helped much.
I was comparing, okay, it's in addition to my salary. I appreciate that. And also I was comparing with my friends. In some private surgeries in Harare, there's a small difference. So if I put accommodation cost and commuting cost, I think it goes a bit better.
When I graduated from the University of Zimbabwe, I wanted to join government, but I chose the Ministry of Health, especially Chegutu district, because there was EU was paying a retention allowance.
60% of our clinics in the rural areas didn't have nurses. And today, we can proudly say each of our clinics has got 2 primary care nurses.
Can you tell Mrs. Fania that you want to change it? She's soft.
The primary care nurse is one who is meant to go to the rural health centers and do the ground work there. If she's unable to manage the cases, then she sends to the hospital. This was the idea about primary care nurse.
PCNs, they go for training for 1.5 years, and the RGNs, they train for 3 years.
I trained here and I finished last year on the 1st of July. And right now I'm working here. At times there's little staff, so you find it difficult to manage, but I am really enjoying the work.
The other area they've supported is the issue of transport. We lose mothers because they cannot get to health facilities quickly. So one of the areas they promised to support, and they've now supported, is the purchase of multi-purpose vehicles. It's important to mention that multi-purpose. They did not buy an ambulance only. They did not buy a service vehicle only. They bought a multi-purpose vehicle, which can be used as a service vehicle or as an ambulance.
Then manisi bandi bafonera manisi kuchitatu bafonera ambulance yekuno kwamurewa. After 15 minutes ambulance yanga yasvika kuchitatu. Then bandatakura vandasvika kuno kwamurewa hospital.
3 months ago we received €5,000 from the European Union for us to purchase fuel, and last week we collected a new Land Cruiser for hospital purposes, and that is a very good relief. Now it is being used for a vaccination program for H1N1, and it is actually helping us.
The uniqueness of their support has been they have not come up with the parallel structures. They have actually supported our structures and strengthened our structures.
We have always felt that the health policies in this country were good policies, and therefore we need to support them. There was no point in doing something totally different than outside of the government. No, there are several donors who are also doing this incentive package or retention scheme. It's no something that is considered normal. But at the time we started it, at the end of 2006, it was considered not something that we should do in this country. So we are very proud that we have done it.
Kubvira kutanga wandakaita madrugs ndongogara ndishuya panapa shiwana madrugs avo mwedzi pega pega vanongotipa madrugs anokwana mwedzi.
Tiri varimi tinorima tiri muno mubhuku rekwaNazare Jam. Saka ndiri munhu anongotambudzika neBP. Asi nekuda kwekunwa mishonga yangu yandinonwa iyi ndokwanisa kurarama. I could see some of the boxes with those tags with the stars, and I later learned that these are EU drugs. So I'm happy that I'm one of the people who benefited from those drugs, and it was just free of charge.